Welcome back. Next up, we have Hassan Tetteh from the Joint Artificial Intelligence Center at the Department of Defense. Please join me in welcoming Hassan to the stage.
Thank you, Rachel. My talk today is going to be Beyond the Hype, How to Deliver AI and Transform Healthcare. It is an honor to be here visiting and participating in the AI 4 conference. I'd like to thank the conference attendees for the kind invitation to share our experience here. Let's start off with a question. Why hasn't AI decreased cost and improved healthcare outcomes? The answer actually is very simple. It's really, really hard to do that. It's really hard to decrease costs and improve health outcomes without AI. It's even more difficult to do it with AI. AI is simply a tool to improve business processes. And we've been challenged for many years with the difficulties of trying to decrease costs while improving health outcomes. What I'd like to share today, though, is some experience as well as a framework that we have employed at the Joint Artificial Intelligence Center to actually help improve both health outcomes and make an impact on cost, efficiencies, and the care of our warfighters in a very positive way. As I mentioned, the reason why it's been so hard is because it's really hard to do this. When you think about AI and it's being its new dominant emerging technology, it is essentially introducing the order of a new thing, the new order of things. And it was Machiavelli who I think very astutely recognized that there is nothing more difficult to take in hand, more perilous to conduct, or more uncertain in its success than to take the lead in the introduction of a new order of things. And certainly when you talk about bringing AI into the domain of healthcare, that is in fact what you're trying to do, bring in a new order of things. Very difficult to do. To give some context and background as to how the JAIC came about and what the JAIC is doing specifically in the domain of healthcare, it's important to think about the landscape and the current way that AI is actually transforming warfare. AI is transformative in that it is a general purpose technology, much like electricity, that has impact across every domain and sector. It's happening now. Our colleagues at the Defense Science Board unanimously concluded that AI advances have reached a tipping point, indeed, because of computer technology, because of the data, computing power, and of course, the talent in AI that is now ubiquitous. It has powerful military applications. AI applications span military robotics, autonomous systems, control and command, business systems, and much, much more. And it's clear that this is a key priority for China and Russia. And to that extent, it becomes a national security imperative for us to maintain leadership in AI, because there will be major implications for US national security. An AI-enabled shift in the military balance of power, in fact, and indeed would have major catastrophic consequences for US national security and our global stability. So to that end, due to policy, leadership, and several administrations recognizing that this is a key imperative, the Joint Artificial Intelligence was established within the Department of Defense to serve as a catalyst, a partner, and a tool for the transformation of the Department of Defense by leveraging AI. Why the JAIC? The JAIC is really here to serve to accelerate AI adoption, support warfighter business processes, bridge the gap between those areas within the department that are excelling at AI and those that are not even started. And of course, lead in the governance of the responsible use of AI, the ethical use of AI, and of course, the propagation and advancements of this technology. The JAIC responsibilities are several-fold. We have a senior AI official in our leader, General Michael Groen, who reports to the Deputy Secretary of Defense. He is leading an organization of almost 300 strong now to advance and scale AI activities across the department. We have industry and academic relationships we're building on an ongoing basis. We are driving AI education and training throughout the department. And of course, we're coordinating AI efforts across not only the DoD, but intergovernment, as well as our partners, both internationally and domestically. And what does the JAIC do? We simply do several things, but most importantly, we lead AI adoption at scale across the enterprise, accelerate joint AI capabilities among all of the services, provide enterprise services for the DoD, and serve to create an AI-friendly ecosystem, all to foster this transformative initiative. And among the key elements of the JAIC and its organization is mission initiatives, our mission initiatives. Each one of the mission initiatives is carefully designed, constructed, and has been established to be a means to have widespread impact across the department. And so in those various domains that you see outlined here, all buttressed with a joint common foundation, which serves as our platform and our infrastructure for developing rapid AI ops and operations and testing and evaluation. We have several mission initiatives: Joint Warfighter Operations, Warfighter Health, Business Process Transformation, Joint Force Protection, Joint Logistics, and Joint Information Warfare, all working collectively to fundamentally change the department, transform it, and leverage AI to do so. We also employ a concept which is very well established and known within the military, which is an integrated product team. An integrated product team is a team composed of representatives from appropriate functional disciplines working together to build successful programs, identify and resolve issues, and make sound and timely recommendations to facilitate decision-making. Absolutely imperative when you talk about advancing AI. The emphasis of IPTs is on involvement of all the stakeholders, users, the customers, the management, developers, contractors, and of course, those that will actually be impacted by AI in a collaborative forum. Typical IPT compositions representative here are about 8 different sort of skills and expertise coming from product managers, stakeholders, testing and evaluation leads, infrastructure domain experts, mission leads, of which I represent that component, data lead, data science and AI leads, lead engineers, policy leadership, as well as experts in acquisition and contracting. Here's just a very brief kind of timeline that highlights some of our JAIC Warfighter Health milestones. Of course, the JAIC was established in 2018. First AI deliverables were in 2019. And in the fall of 2019, the Warfighter Health National Mission Initiative was established. In April 2020, Project Salas served as one of our first use cases that was deployed in the midst of the COVID pandemic. I'll highlight the importance and the impact of that in a moment. August of 2020, we had our first AI cloud environment deployed. And Warfighter Health hosted its first fellow from the Air Force also around July of 2020. In the fall of 2020, the Warfighter Health team deployed its first augmented reality microscope, another one of the use cases that I'll highlight momentarily. And in October of 2020, General Groen from the United States Marine Corps became our second JAIC director, leading us into the new calendar year of 2021. JAIC was realigned to report directly to the Deputy Secretary of Defense. We also obtained acquisition authority, which gives us a lot more capability in terms of contracting and bringing on talent into the organization to help serve with our initiatives. And we have now launched a new initiative called JAIC 2.0 to scale and further foster the mission of the JAIC. Before the Warfighter Health mission came to fruition, the JAIC had other missions. There was a unique opportunity to leverage the rich data set and the rich data that we have across the continuum of a service member's record. From the time they're enlisted all the way to the time that they are transitioning out of the military, there is a collection of vast amounts of information, both in written, digital, and imaging form, that could be used to train algorithms and to gain insight from that data. Coupled with that and the unique problem sets that we have in terms of wanting to identify our readiness for a warfighter and their ability to perform and to execute the mission at the highest peak levels, this information, this data, and the ability for us to gain insight from that is what really leads to one of the value propositions for the establishment of the Warfighter Health mission. More importantly, however, is the ability to leverage all of the tools, resources, and the invaluable talent that we have within the JAIC to bring to bear the partnerships and to leverage those partnerships so that we can do truly transformational things within the military medicine landscape and ecosystem and enterprise. At this time in history, we are on the precipice of great technological advances in AI. It will be the military that will be the vanguard of that technology. We have a track record for having those transformative technologies that have fundamentally impacted military medicine, but more importantly, impacted the civilian sector. The military has always led. We've led in vaccine development. It was Washington's Continental Army that developed the concept of varicellation and giving smallpox inoculations to individuals so that they would have immunity to this devastating disease. It was the Army that pioneered the banking of blood, which has now become quintessential and necessary in the treatment of trauma. It has also been the military that has made great advancements in electronic health records in the early days of that technology. So much so that we were among the first to go from paper to electronic charts. Today, AI stands to be the new transformative technology, and the military will lead in this effort through the JAIC, through our Warfighter Health mission, and by leveraging the cadre of experts, expertise, and the resources that we have within the Joint Artificial Intelligence Center. The famous futurist Roy Amara said, "We tend to overestimate the impact of technology and innovation in the short term, but we tend to underestimate the impact of technology and innovation in the long term." At the JAIC, we are working every day to make sure we are prepared and ready to deliver the best technology to our warfighters and make sure we have an edge at the Department of Defense and throughout our nation. So delivering AI, particularly in healthcare, is a very elusive and difficult thing, as I mentioned in the beginning. What I'd like to do, though, is show you how we are going about delivering that AI technology and that capability to our providers so that it can improve warfighter health. So using the Warfighter Health team and the integrated product team construct, we have focused our energies in three big domains that truly do cross-cut almost all aspects of warfighter health and healthcare delivery within the military healthcare system. That is Warfighter Readiness. Our primary objective is to always ensure that our fighting force is optimally ready to deploy at any moment, and also while they're deployed, that we can take care of them and serve their needs in their injuries and when they're ill and wounded. And so that is one big domain. Human performance is also very important to optimize the warfighter's ability to serve in their respective missions and to be successful in prosecuting the mission objectives. And of course, in combat medicine, being ready to serve as a resource to take care of those that are injured and fallen from injuries and trauma. So within the Warfighter Readiness domain, we have a number of initiatives that we're advancing. Among them are the Medical Evaluation Readiness Information Tools, which is leveraging the vast amount of healthcare records and information to have predictive support provided to our providers at the point of care. Project Salas, which I'll highlight briefly in upcoming slides, and then medical imaging, which also is another very important initiative that has shown great promise in delivering AI capabilities to enhancing diagnostic capabilities to our pathologists so that they can serve the needs of the warfighter even better. Under human performance, we are using vast amounts of data and technology on networks to help identify destructive behaviors before they happen, such as suicide. And we have developed a suicide prevention integrated product team to serve to develop suicide ontologies, help with deploying commanders' risk mitigation dashboards that can help commanders identify those service members that are in need, and also personal assistance for lifelong learning, which is a tool that helps the individual service member optimize their career opportunities throughout their entire enlistment by using AI and novel technologies. And in combat medicine, we are increasing data accuracy so that one day we can help to better serve the needs of those in the war space and battlefields. through Warfighter Health data commons maturation, and also point of care technologies that we can bring to bear that will employ AI and autonomous systems to help those in need. So one use case under the Warfighter Readiness portfolio, which really shows how you can build solutions for early detection of disease, is that of Project Salas. We used it, in fact, as I mentioned, in the spring of 2020, in the midst of the COVID-19 crisis, to help bring into a platform disparate data from all across the country, from supplies to hospitalizations to ICU admissions, to give us a tool and a platform that could help predict not only where there was going to be disease severity down to the zip code level, but also help us guide our distribution, allocation, and the adjudication of resources to where they were most needed at a time of great need and crisis. We've also scaled this platform to bring us the ability to help target vaccination strategies to regions with intensifying disease spread that is associated with new variants as they emerge. Another great use case of success that really shows how team, talent, processes, and of course, having that engineering of the human in the middle comes to bear in terms of a success of deploying AI capability is that of our Warfighter Readiness Medical Imaging integrated product team, which is deployed now to several locations, military treatment facilities, to include the VA hospitals, an augmented reality microscope, which is represented here in the picture, and the care provider that's looking under the microscope and has circles that are drawn around the pathology. In this case, this is prostate cancer. What that represents is really truly the hard work that I referenced in the very beginning. It's really hard to do this. Seeing this picture here, and this is just the tip of the iceberg, but culminates in almost a decade worth of work, taking almost 500,000 different slides of tumor specimens, training using computer vision, algorithms, and machine learning to develop the algorithms to deploy with this interface that is able to provide this capability at the point of care for the enhancement of care that we deliver to the warfighter. This is our process framework. It's developing a use case, finding the skills and talent that are needed to develop that use case, to apply AI solutions to the problem set. Of course, data is essential. That is one of the great benefits, but also one of the challenges within the military. We have a lot of data, but it's not always curated in the most effective way to be applicable and AI ready to be employed for machine learning. And of course, is the technology and the compute power, the infrastructure, and then of course, having the organization. And in this sort of continuous cycle and of enhancement and organization, this is done over and over again to bring to bear those two product use cases that I highlighted, of which we have many more, but in the interest of time, wanted to point out just those two and highlight how the process framework comes to bear in bringing success to these deliveries. So all of this culminates in what we like to think of as health and business transformation within this domain: community building, senior leader engagement, process definition, solution design, prototyping, and scaling, all to enable sort of the department through an enterprise solutions approach to develop the capabilities that are going to enhance our ability to take care of our warfighters. And that's just in our particular mission. This same process, the same types of teams are also employed within the other mission initiatives to make fundamental differences and impact at scale, leveraging AI within the other domains so that we'll have true impact collectively across the Department of Defense, and that will also impact the civilian sector. So in summary, there are certain elements that are absolutely essential to really delivering AI. I will preface it by saying it's really, really hard to do this. It's not easy. When I was at the War College during my studies in national security strategy as the only physician, I had the opportunity to spend some time in a thesis project on AI and military medicine. And my conclusion was this: even within the military health system, with the talent and the skills that we have there, we were unable, in my opinion, in my estimation, to be able to deploy AI technologies and solutions at scale without the help and the leveraging of resources of a great number of many people. And so the JAIC really represents, I think, the centerpiece and the center of excellence for bringing to bear all of the resources that are necessary to be able to advance AI in a meaningful way across the department. So team, talent, processes, leadership, and very, very hard work are all necessary to lead AI adoption at scale, accelerate AI capabilities, provide AI enterprise services, and create an AI friendly ecosystem. And perhaps most important and paramount to all of this is this factor: engineering the human into everything that you do while you're working to deploy AI in healthcare and quite frankly in any domain is absolutely critical. Without having the human in the center from the very beginning of the development to the deployment to the maturation to the scaling, you will definitely be unsuccessful. I'd like to thank the audience for your attention and time and entertain any questions at this point. Thank you so much.
Thanks, Hassan. That was a great presentation. And audience, now's your time to move to your next session. Don't forget to check out our amazing exhibits along the way.